even, you know, when they, like, obviously when they make money, like, you don't want to have it means tested that way.
So the problem with Medicaid is it's supposed to be a safety net.
Yeah.
People are supposed to fall down, they lose their job, they get sick, they get injured, can't work for a time. Okay, that's there. You know, single parents that, you know, with whatever, it's there. Okay, it's a safety net.
Yeah.
You're supposed to get off the net and then start walking back up the stairs again. You're not just supposed to lay in the net. But the net is so damn comfortable that nobody wants to get off the net anymore.
Hey, and especially you get those heated blankets, those are nice.
That's what I'm saying. And then you climb up these stairs and you're like, this blanket's itchy. This doesn't feel good at all. Why don't I just go back to the net?
Yeah.
You know? So, that's an issue, man.
Yeah.
I really hope that some smarter people than me, smarter people than we have in government, can come together and be like, hey, let's think of a rational, logical way to both care for our poor, but also incentivize going back to work and getting insurance or whatever. I don't know what it is, but like,
Ricky, are you going socialist on me right now?
Oh,
are you going socialist on me right now?
What did we do to the Indians, huh? Take the Native Americans. Did providing everything for them help them? Or do we cause massive diabetes and alcoholism and abuse?
Ricky, that is personal. That is personal. That is personal. That is personal responsibility.
Oh, okay.
For the Indians.
Okay.
No, but I think you're right. I think that we need, like, I agree with the concept of Medicaid, because obviously we do have desperately poor people and underclass people in the United States.
And how great that they can freaking
afford
they're
help.
struggling. They need something. Okay, I can go to the doctor for free. I can go to the ER for free. Like, that's great.
But the problem with that is, like you said, is that once you give something for free, it makes it very difficult for people to actually have to pay for something.
Very difficult.
And so that's why you see constant, like, almost every year you hear about these huge cases of, like, Medicaid, like, fraud, like, because people don't want to go off the system. It's such a good system that it probably needs to be reworked in such a way that either, you know, you raise the means test of it so that people may be making, you know, probably like $45,000 to $50,000 can, you know, be on the system. But also you need to probably have a system in where a lot of those co-pays and deductibles and things like that and cost of, like, drugs are more affordable to people.
Agreed.
So
my world is ER. Like, what I know is the emergency room, and what I've seen is massive abuse of what the emergency room is supposed to be. I could tell you countless stories of people coming in for the most minuscule thing you wouldn't believe.
Yeah.
People come in because they were walking to McDonald's and then they remembered that their elbow had been hurting for 3 weeks. So on my way to McDonald's, I'm just gonna stop in real quick and get my elbow checked out that's been hurting for 3 weeks. Like, what?
Yeah.
Or a little a sunburn, or I stubbed my toe, or I'm telling you,
I've been in the ER, so I know exactly.
I was in the ER. I mean, there's times where a mother, and you know, I don't blame the mother for bringing her kids to get checked, because people don't have the knowledge of medicine. So I get it. But what? I had a time where a mother brought in her child because that morning they started sniffling. Okay? So the main complaint was sniffling. They had 3 other kids there without symptoms. No symptoms. This is before COVID.
Yeah.
She said, well, I'm just going to get them all checked out just to be safe. I said, well, ma'am, if they don't have an actual complaint, this is an emergency room.
This is a waste of time.
He said, well, you know, we're here, so let's just get them all checked out. Okay. I'm looking at the calculator in my head then, saying, okay, so we're spending how much money?
Time is money.
Yeah.
And
treating this situation when this needs... The one child just needs to go to their normal primary care doctor, pediatrician, whatever. Yeah. But the problem is... people don't understand some of these concepts. Yeah. So public education is very important.
Key, in my opinion.
Yeah, but we need kind of an overhaul of the way we do things, the way we charge things, and I'm hoping somebody, like I said before, somebody needs to come along, maybe a little group, maybe call it a task force, and bring it together and make it happen. Okay.
Are you saying that Hillary Clinton should head this task force?
Oh God.
They actually did this in the 90s, so she headed a task force on
healthcare. How is she allowed to be how is... I don't want to hear Clinton. I don't want to hear Cheney. I don't want to hear Bush. I just get it out of here. You know what I'm saying? Why are they allowed to be here still?
It's just the way our politics are.
One of those things. But yeah.
Yeah, I think there definitely needs to be highly better. Like the biggest reform I need to see in the healthcare industry, or at least just medicine in general. Stop advertising your drugs on TV. People are idiots. They will buy anything. It's just oh, I got a sore. I need that. It's no, you don't. You need to exercise more and probably.
Well, the drug. I mean, the drugs on TV are brand drugs that they are trying to get the consumer, the customer, to go to their doctor and say, "Hey, I saw this thing on TV and I really want it." And hopefully, if they have commercial insurance, this is where the commercial insurance comes in, the private insurance. Hopefully, if they have that insurance, they can get most of that covered. That's the goal.
People should just educate themselves.
That's what I'm saying. Okay. All right, what else we got?
Also, we got right now, Joe Biden is talking about some of his task force he's going to put up and things like that. And so, I don't know. I guess the big question right now, he's set up a task force to reunite, separate children at the border. I don't know. You think a lot of this stuff is just a little too late, a little too small to do right now? He's trying to get out his stimulus right now. I think the price tag on it, or at least the size of it, he wants to be 1.9 trillion. So I don't know. Do you think that all this stuff is kind of a little too late, or is it just in the nick of time? Because one big thing to me, just in my personal life, is that they did extend zero interest payments to student loans until September of this year. So,
yeah, I think that was going to happen no matter what.
It wasn't guaranteed.
Yeah, but it was going to happen no matter what. I think whether it was Trump or Biden, whoever it was probably going to do that, because guess what? When you take away people's jobs, you have to kind of give them an out. I mean, you have to, But, I guess it's a good thing. And it's late. The issue, and we should probably bring this up, is that the $1.9 trillion does include the $15 minimum wage thing nationally. So my issue with this are multiple.
Many.
Would you believe that I have multiple problems with a $15 minimum wage? You believe that? It's hard to believe, I know.
It's hard to believe, but I don't disbelieve
without me, I gotta stretch before I talk about this one. Gotta do some meditation to relax. Okay. 3, 2, 1. I like that we're thinking about the poor.
Mm-hmm.
I like it. The problems. Okay. 1. You know how different things are in different places? I know Joe's driven. He's flown around the country. He's seen the states.
I thought you were going to say he's been on a horse and wagon across the United States.
He might have.
He's old. He's not that old. He has a Corvette, so...
You know how different it is between freaking nowhere, Kansas, and San Francisco? You know what the difference of a $15 bill is? Well, it's $15 bill. You know what the difference of $15 is between those two places?
Yeah.
Is astronomical.
Well, you don't have to go to those extremes. Just look at a place like Chicago and then look at northern Indiana.
Okay.
Completely different.
Point being is that to have one, if you're gonna do the minimum wage, why don't you let the state decide? Because the state is going to be much more accurate than a giant conglomerate. Like, it makes no sense.
Well, some states like California have pushed up for like $15, and the issue I have with the $15 minimum wage, one, it's only going to go to federal contractors, so it's just making people who have already benefited from the federal government more wealthy. So,
is that right?
Yeah.
It's only federal contractors?
It's only federal contract and federal employees. So, like, that's the thing I have right off the top. You're just making people who are already so-called leeches on the system more wealthy. Secondly, like you said, it's not going to apply to states broadly. So, what's the point of having a federal minimum wage? Well, for one, it's not going to balance the playing field for people who are underemployed. Most of our economy is built off of gig workers. People that work for Uber, people that work for Amazon, people that work for Walmart. So they're not going to really be that much benefited from $15 anyway, because most of these people are already living paycheck to paycheck.
Yeah, in my mind, it's the concept as well. It's like, okay, say you have $30 to pay Johnny, Susie, and Tim. Okay, Johnny, Susie, and Tim all get $10 an hour to do their job, right? Mm-hmm. And all of a sudden, we say, okay, $15 minimum wage. Okay, well, either Johnny, Susie, and Tim have to all work less hours now and get paid less, or, what else can we do? Well, Johnny can get out. Okay, and so Susie and Tim now make $15 an hour, but now they have to pick up for Johnny's responsibilities. Okay, so Johnny gets the bucket, he's gone, he gets unemployment, and then